Watch, we're following the latest on the coronavirus outbreak. Health officials in Wisconsin confirmed the state's first case yesterday, and that brings the total number of confirmed cases in the U.S. to 12. Worldwide, more than 28,000 people have gotten sick and more than 560 people have died. Ramy Inocencio is standing by in Hong Kong. Ramy, how are authorities there responding to this outbreak?
Sure. The countdown definitely is on to a 14-day quarantine for anyone coming across the border from mainland China, be it a citizen or a foreign national or just a travel. Anyone is applicable to this quarantine that will be starting this Saturday, rather. But as for this cruise ship right behind me, about 4,000 passengers as well as crew are stuck on it. They can't get off because at least three crew members have fallen ill. Of course, the fear here is that they've fallen with the coronavirus. And as for Americans who have been evacuated out of Wuhan, they are under observation back home in the country for any signs of sickness.
At least 4 newly arrived American evacuees from Wuhan are now showing signs of sickness. They landed in California Wednesday and are now in isolation. Nearly 350 others are under a public health quarantine, the CDC's first in 50 years. Priscilla Dickey and her daughter are among them.
They're basically going to make sure they're keeping a really good eye on us.
In Japan, 2 U.S. citizens are among at least 20 evacuated from this cruise ship diagnosed with coronavirus. About 3,700 passengers in total are now confined to their cabins for 2 weeks as doctors test each person. Eric Pagan is worried his medication won't last.
I'm going to run out. I have some medicine I take, but I'll probably be good for another 2-3 days. That's about it.
In Wuhan, ground zero for the outbreak, authorities sprayed the streets with disinfectant and turned a convention center into a makeshift hospital that's now receiving patients. But China's response in Wuhan was too slow for Xiao Huang. He spent days searching for a bed for his grandfather just in this hospital hallway. He died shortly after this video. Huang is now worried his grandmother may be next.
If they were admitted earlier, things would have been better, he says.
And as this crisis deepens, rising calls for aid. The World Health Organization is now asking for $675 million.
In the last 24 hours, we had the most cases in a single day.
Ramy, that was really hard to hear from that man about his grandparents. You'd mentioned authorities in Hong Kong will be implementing a 14-day quarantine for anyone entering from mainland China. So how exactly will that process work?
You know, Laura, that's a really good question, and it's the question here that everyone is asking because no one knows that answer. For example, there have been some ideas of floating the use of a prison that is no longer in use, but the government hasn't answered to any of those questions there. In addition, there was a residential estate that had been floated to be used to be a place for quarantine, but people who lived in that area actually firebombed that estate so that they couldn't be used as well. So you can see a lot of people are very anti anything coming across the border, whether it be the virus itself or people coming across the border with it. And it's just showing that the government is sort of powerless or unable to answer these questions, which is also raising tensions even further.
And what about where you are in Hong Kong? What's the mood like there?
Sure. Well, walking across the central business district at around 5 p.m. Earlier today, it was very, very quiet. There should have been red taxis, known here in Hong Kong, the iconic red taxis there, minivans, people rushing across to get to the subway station, the MTR station. But it was very easy to walk around. You could hardly see any cars. Everyone I passed was wearing some kind of mask to protect themselves, very similar to what we were seeing in Beijing over the past 2 weeks. There is a sense of anxiety, a sense of concern, but there is not a sense of panic. It's very much watch and wait, and everyone is trying to stay away from each other just that much further, what's called a social distancing, to make sure that they don't get this coronavirus.
Well, Ramy, thank you so much for your continued reporting on this coronavirus.
You bet.
And in just a few minutes, I'll be speaking with CBS News business analyst Jill Schlesinger about the financial impact of the coronavirus. You can catch that conversation coming up at 7:35.